Hey everyone, Surgeon Brandon here, and I'm here with you today to talk about pelvic anatomy. Specifically, we're going to talk about pelvic osteology, or the study of bony landmarks or structures of the pelvis. And I'll have a model that will go over things. The intended audience is going to be for those that are trying to learn more about the pelvis or anatomy. Perhaps you're in medical school or in residency or in some sort of medical training and want to get more information. It may be advanced for those that don't have any background, and it may be somewhat cursory for those that are very advanced in their career. But let's go ahead and get started. All right, so this is our model for reference. This is anterior and this is posterior. This is straight midline. This is lateral on both sides. This is more superior and this is inferior. Here's your proximal femurs on both sides, your hip joints, your sacrum in the back, coccyx, lumbar vertebra 5, lumbar vertebra 4, the intervertebral discs between the two. Here's your hip bone on both sides, and it's comprised by three different structures: the ilium, the ischium, and the pubis. Together they conjoin and form your acetabulum. You can see a side view there. Working on more bony prominence going from anterior to posterior, we have the pubic tubercles here in the front. We have your pubic symphysis here. You have the superior pubic rami on both sides, inferior pubic rami on both sides. You have the pectineal line here and the archaic line. And this prominence here is the iliopubic eminence. Working on some more bony landmarks, we see the anterior, inferior iliac spine and the anterior, superior iliac spine. Here's a side view. Notably, the lateral femoral cutaneous nerve, which innervates sensory to the lateral aspect of the proximal thigh, goes under the inguinal ligament, which attaches the pubic tubercle, and the ASIS, and courses under there, with the origin of the sartorius also being over there. Working more posterior, we see the iliac crest here. And on this view, it's also important to note the difference between the false pelvis and the true pelvis. So it's referred to as the false pelvis when you follow the course of the iliac crest, and the true pelvis as you go deep into the brim, or the pelvic brim, it's sometimes referred to as. And you can see those two separations there. Working our way more in the back, we'll go from the side view. We see the posterior superior iliac spine, the posterior inferior iliac spine. We see the ischial spine. We see the greater sciatic notch, where your sciatic nerve courses through, and the lesser sciatic notch. Also in the front, you see your obturator foramens on both sides, here and here. And here in the back, going a little spine anatomy, we see the transverse process, spinous process, lamina, the facet between them. And that's all we have for today. So there's the osteology of the pelvis. Thanks, everyone.